Hello, everybody. This is the second part of the chapter 8 regarding the articulations or joints. So far, we have talked about all the different types of the joints structurally and functionally. Now, we're going to talk about more regarding the movements, the type of the movement, how do we name them so that's the whole purpose to know about the joints, and that's the way that we are examining the joints, that to see that they are working well or not, because each joint has a specific type of movement, direction of the movement, ability to the movement. Not all the joints are the same, so we need to categorize them, name them, so that we can discuss about them in a common language, right? So for the type of the movement, we have these 5 types of the movement. Linear movement, those are the movement that they are happening in a line. Angular movement, that they are making an angle, like for example, that when we have making an angle here between the humerus and the body, this is an angle, so this movement is an angular movement, increasing the angle or decreasing the angle, right? Circumduction, when the movement happens in like a circle, like for example, when you make a circle, when you go to the gym, you sometimes you do this movement, circumduction, right? You move in a circle. Rotation, like one part of the limb just rotating around, like for example, this arm is rotating around the long axis, right? This is a rotational movement. Or your head is rotating along this axis, right? This is a rotational movement, right? Then we have the special movement at the end that is not part of these ones, and those are for the specific parts of the body. They have specific names for themselves, and we're going to talk about. So for the linear movements, that's when the two bones or two bones gliding past each other is like that. We just go over, like if this is one surface of one bone, this is the surface of other bone, and they are like this, they just moving like this, like the two plates. We have them like between the carpal bones, like you remember we have 8 carpal bones, and many of them have these type of the joints between them. They are gliding type of the movement, right? Those are linear movement. Between tarsal bones, the same. And also between the clavicle and sternum. Clavicle actually has the two ends, clavicle and sternum, clavicle and acromion. Also, both sides are the linear movement. Then we said that the second type is the angular movement. Angular movement, if they are in the frontal plane, in this plane, you remember this is a plane, frontal plane. If these movements happen in this plane, like this one, if I move my arm going up and down on my side in this plane, this is called abduction and adduction. Which one is abduction? When the arm is getting away from the center, the central axis. This is the central axis of the body, right? The longitudinal axis here. When the arm getting away from that in this angle, the angle increasing is called abduction. When it is getting back, getting close to the body is called adduction, as if that you're adding your arm toward your body, right? So that's abduction and adduction. Pay attention that we have abduction and abduction in many parts of the body, like even for the hand itself, right? If you consider this middle finger as the axis here, now if other fingers getting away from that, we can call it abduction. If they're getting back toward the middle finger, we call it adduction. The same is for the leg, between the leg and the hip. If the whole leg get away from the center, it's called abduction. If it gets back, it's called adduction. So pay attention that as we are talking about the movements, later in the next chapters, we are going to talk about the muscles and their names, right? You will see that some muscles get their names according to their function, what function they are doing. And just here, learning these movements and their names well will help you to understand the naming of the muscles and according to that their function, what they are going to do when they contract, right? Like some of the muscles they just called abductor or adductor, right? Because when they contract, they do that job. Like some of the muscles in the medial side of the leg, when they contract, can you guess what they do? When it is the axis of the body, and this is the leg here, and you have some muscles. If I just show the leg like this, like imagine this is the leg, this is the medial axis of the body. So you have medial side of the leg and lateral side of the leg. If some muscles in the medial side of the leg contract, what they do abduction or adduction. They do abduction, right? Because they are going to bring the leg toward the medial side, right? So those are adductor. So later you will see that you have some muscles here that you call them adductor, right? If it is on the lateral side and that one gets contract, what they do, they are abductor, right? So the same way in the hand, you have some adductor muscle, some abductor muscles like this, right? So that's in the frontal plane, right? So this is an angular movement in the frontal plane, abduction and adduction. Now, if the angular movement happens, means that the movement is going to change an angle, but that's in the sagittal plane, right? In this direction of the body. Like for example, if I put a stand, I will show you that in the anatomical position, you remember the hand is next to the some side of the body in the frontal plane, right? But if you move it in this direction, in the sagittal plane, if you like here decrease an angle, you're having this angle between the hand and the forearm, right? If you decrease this angle, this is an angular movement, right? And this is in the anatomical position, and this it should be down, but I just want to show you. So if you decrease this angle, that the movement is in the sagittal plane, here in this plane, right? So this is an angular movement. What type of angular movement? This is called flexion. When the angle is decreased, it's called flexion. When it gets back to the original angle, it's called extension. And if it goes beyond the original angle and it gets even more angle, we call it hyperextension. Right? So let's go and see all these movement in the picture, but always remember that angular movement, we have it in the frontal plane, we call it abduction, adduction. We have it in the sagittal plane, we call it flexion, extension. Now here you're looking at the angular movements here, and you see that you have it, movements are in this plane, in the frontal plane, right? So this is the original position here. When you're getting that more away from the center is abduction. When the arm gets closer to the center or the long axis of the body is called adduction, right? Pay attention that the movement is around this point here, right? The same is for the leg. If leg is located here, getting more away from the body is abduction. Getting closer to the center is called adduction. The same is for the wrist here. The wrist, if it gets away, the whole wrist from this point is abduction. If it gets toward the body is adduction, right? As you can see that here, we're comparing this point here. So if this is the neutral position, getting away from the center is abduction. Getting close toward the center is, oh, this is the other hand. This is this hand. So this one is getting close to the center of the body. This is abduction, and this one is getting erased, so that is abduction. Now, if you look from this angle, you see the movements are in sagittal plane, right? The plane that is passing anterior to posterior. You remember the previous one that was frontal plane that passes side to side. Now this one is sagittal plane that passing anterior to posterior. In this plane, this is the neutral position, for example. We're talking about this angle, right? If we're talking about this angle between the body and the leg, right? If you decrease this angle, it's called flexion. We're talking about this joint here, right here, hip joint. Then, if this angle increase, this picture has a mistake here actually. That's from your book too. That's the same picture from your book, but the actual defining is that you have this angle here. If you decrease this angle, like it was 180, right? If you decrease it, like for example, say 120, right? This is flexion of the hip joint. When you get it back to the original angle that was 180, then this will be called, like this arrow up to here, will be called extension. When it goes beyond the original, continue and goes beyond the original, is called hyperextension. So this one is actually hyperextension in this position, right? The same way for the shoulder, for example. Shoulder haven't been drawn here, the elbow has been shown here. So if we're talking about this joint, elbow joint, so the actual angle has been here, right? So if you decrease the angle here, this is flexion of the elbow. If it get it back to the original position up to here, this is extension. And for the elbow, you cannot get back beyond that one. We do not have much of hyperextension for the elbow, right? But what about the neck here? So this is the neutral position. If you decrease this angle, bring it here, you make it this side, this is flexion. If you get it back to here, is extension. If it goes more beyond that and make this angle here, it is hyperextension. So pay attention to the correct explanation here. So although in your book have been shown here, the correct one are the one that I just mentioned. And here for the wrist also. So we have an angle 180 here, right? So if we decrease the angle, this is flexion. And if we get it back here, this is extension. And if it goes beyond that, is hyperextension. So besides the gliding movement and angular movement, we have rotational movement that is when the movement is happening, rotate around the long axis, like for example, pronation and supination in the forearm, right? When you remember, we had the supine position when the whole body is lying down face up. We have also that for the whole forearm too, right? In the anatomical position. When the hand is in this position, it is called supine position. This is the anatomical. When we rotate it and the back of the hand comes toward anterior, we call it pronation. And this is the one happening due to the rotation of the radius over the ulna, right? So that's pronation and supination. Those are rotational movements. And circumduction movements, that moving the joint in a circular manner. It is like this. So this is a circumduction, right? Like making or drawing a circle over the board like that. That might be in both directions, right? Circumduction movement. But this is actually the combination of all previous three types of the, or three types, I mean the abduction, and also flexion, extension, and also the rotation. So all those ones can happen to make the circumduction, and these are the movement that we have, for example, in the joint, in the shoulder joint, and also in the hip joint, that they are triaxial. So here again, you're looking at the rotational movement that might be on the head, side to side, left rotation, like here for me, right rotation, left rotation, you see that here. You may have it around the shoulder joint, that you're rotating from here toward the medial rotation, or we call it internal rotation, and a lateral rotation or external rotation. That's good to understand those ones here, because later when we're talking about the muscles, when we're talking about their movement, we will see that, for example, one function of this muscle is medial rotation or internal rotation. So that's good to understand that the movement is happening at the shoulder area, right? You need to know and pay attention that which shoulder we are, which joint we are talking about, right? So when it's talking about this, the movement is happening at this area around the humerus here. If you're talking about the elbow, the rotation happens around these bones of the elbow here, and it's mostly this side, like the other picture that you see here. The rotation is happening here compared to the one of the shoulder, the rotation happening all here. And also this other one, so when it is on the elbow, we make it supination and pronation, as you see the radius that was on the lateral rotating toward the medial here, rotating around the ulna. And also you see that here, pronation and supination. So that was the rotation, and this one is circumduction that I explained. That's a combination of the movement. Now, besides those types of the movement, we have some special movements because they happen only in a specific situation, and we name them specific. So we have inversion, eversion. These are all in pair because they are acting over one specific joints and they are opposite of each other. Inversion and eversion, dorsiflexion and plantar flexion, lateral flexion, protraction and retraction, opposition, and depression and elevation. Now let's see each one of them, and you need to know every single one of these, right? So for the inversion, as you see, it happens in the between the ankle and the foot here, and the inversion is when the inside of the foot here, it's just like, imagine this is your foot, imagine this is the leg and this is the foot. If I put it in the complete angle I can, but just know that this is the foot, right? This is the medial side, imagine this is the lateral side, like my body, right? This is medial and lateral side. If I bring this medial side up, this is inversion, right? If I bring the lateral side up, that is eversion, right? So that's inversion and eversion. The other one again is regarding the ankle. Again, in the neutral, the foot is flat here. This upper part of the foot is called dorsum of the foot, right? The one that when you look, you will see that. Compared to the plantar surface, that's the sole of the foot. So you have dorsum of the foot, the sole that is called plantar surface. Therefore, for these ones, for this angle, we call both of them flexion, so we do not have extension here. So if it goes toward the dorsum and flex, we call it dorsiflexion. And if it goes toward the plantar surface and flex, we call it plantar flexion, right? So both of them are called flexion. We're not having extension. Now, for the head, we said that if it goes to the right, we call it right flexion. If it goes toward the head, we call it left flexion. Now, what about it goes to the side? This side or this side? This is a special movement and we call it lateral flexion. So don't mistake it with this. This is not lateral flexion. This is right flexion as if you're looking to the right. This is left flexion as if looking to the left. The whole head is moving and changing direction of the face, right? That's the right and left flexion. But when you're looking forward and you just bend toward the lateral, this is lateral flexion. No matter this side or this side. Pay attention, both of them are lateral flexion. So whichever you be asked is lateral flexion. So the other special movement is regarding the jaw, the lower jaw. And that's talking about the joint that you have between the mandible and temporal bone. You remember you have a joint between temporal and mandible. We call it temporal mandibular joint or TM joint, right? That's the one that when you put your hand here and you open your jaw here, you can feel it here. Just right in front of your ears, right? You can actually do that and feel it. Where does it locate? Yeah. Now, the retraction and contraction is not opening or closing the jaw, but as we had it as another movement, right? But this one is talking about the horizontal movement of the mandible. If you bring the whole mandible toward the forward, we call it protraction. And if you put it backward in the horizontal plane, we call it retraction. So this is like this. You can try it, although you may become ugly. Like this is protraction. Lower jaw comes forward, and if it gets back to the original position is retraction, right? So why this is important? It's important because one of the maneuvers that you are doing during the resuscitation, if you ever need in the hospital or something, or you are expert and your job is that, then sometimes to opening the airway, you need to protect the jaw like this. Bring the mandible and bring it forward so that the tongue on the back that is obstructing the airway get out of the airway and the air that is coming from the outside can pass over there and get to the trachea, right? So that is the one that is not just opening and closing the jaw. Some people may do that mistake. They said just pulling the mandible down is doing that, is not doing that. The airway in this area should get open, right? So that's due to this maneuver. Protraction forward, retraction, retract back to the place. So the other special movement is regarding the fingers here and specifically about the thumb here when it moves from this. You remember in the anatomical position, thumb is always on the lateral side, right? When it moves toward the middle, and you can just go it by opposing that to the little finger. Therefore, we call it opposition. So it's just measuring and examining the ability of the thumb to move in this position. We call it opposition, the special name for the special movement, right? The other one that I was talking about too regarding the jaw is that when you bring the jaw down, not forward or backward, down, we call it depression. When you bring it back up is elevation, the way that elevate is moved, right? So we have depression and elevation that's in this vertical position compared to the protraction and retraction that's in the horizontal. So those were about the type of the movement and their name. Now, we're going to talk about the types of the synovial joints. 6 types of the synovial joints that we have and the examples of each one. Most of the joints in the body are synovial as they are moving, right? So you need to know those ones that have been mentioned here. Some of them have been mentioned on this page and some of them are on the next slide that they have a picture, and in the explanation have, the picture and the explanation, they have the examples of this. So you need to know them. The first type is called gliding joint. As the same way that we had the linear movement, one type is called gliding joint. Sometimes these gliding joints they're called planar joints, like a plane, because as they are moving in a plane, right? So gliding joint and planar joints are the same, just two names, right? The examples of them, like between the joint between the clavicle and sternum, sternoclavicular joint, or the joints that we have between the carpal bone, carpal bones that we have, intercarpal joints that we have, those are just gliding joints. Then the second type is called pivot joints. Pivot joints are the joints that are moving around one axis, right? Like for example, the joint that we have between the C1 and C2 of the cervical vertebra, the first and second cervical vertebra, right? So these two, as we had it before, you know that they are making a rotation, right? So the only movement that you have in the pivot joint is rotational movement. Pay attention to that one. So one example is the joint between the C1 and C2 that we call C1 is atlas, C2 is axis. So we call it atlantoaxial joint, right? And this has a pivot joint. The other one is proximal radio-ulnar joint, right? Like this one. Between the radius and ulna, you have a joint here. When it's moved, rotates around the axis, that's the one that makes the supination and pronation possible, right? So this is a pivot joint, this proximal radio-ulnar joint. The third type is called saddle joint. That is the saddle that I will show you the picture that has the shape of the saddle on the back of the horse that we put. Therefore, they call it a saddle joint. The example of that is the first carpometacarpal joint. Remember carpal bones, metacarpal bones here. So we have a joint between the carpal and metacarpal. We call it CMC. C for carpal, or the metacarpal, MC, metacarpal. So we call it CMC joints. The first CMC joint is a saddle joint. So first CMC is a saddle joint. The other type of the synovial joint is the hinge joint, as we discussed a little bit before. That is the joint that we have that move in one direction, like elbow and knee, both of them. Ellipsoid joint, I will show you the picture because we call it ellipsoid because of the specific shape. I will show you over that how it looks like an ellipse, and that happens in between the metacarp and phalanges, right? These are metacarp, these are phalanges. So these joints that we have here between metacarp MC, metacarp, and phalanges P. So we call this one MCP joints, right? And just reminding you that we're numbering from the side of the tongue. So this is the first one, second, third, fourth, fifth, if you wanted to number them, right? But just these joints between the metacarp and phalanges, like one here, here. So those are the ellipsoid joint. So let's remember this is saddle joint for the first one, and the other ones here are ellipsoid joints. And finally, ball and socket joints that are explained a little bit. Shoulder and hip joints are ball and socket. It is like a ball that goes into a socket and has lots of movement in all three directions, right? So let's go and review them. Gliding joints, or as mentioned here, planar joints here, they are moving over one surface, and these are monoxial joints. And the places that we have here, because monoxial, because they're just moving in one plane, right? So like sternoclavicular joint or acromioclavicular joint. On the both end of the clavicle, they are planar or gliding joint. And intercarpal or intertarsal joint, vertebral costal joint, the joints that we have between the vertebra and the ribs, and also sacroiliac joint, SI joint between the sacrum and the iliac joint. SI joint, you remember, that's connecting the ilium to the sacrum on the back. These are all examples of the gliding joint. The second type is the pivot joint. As you see that these are doing only rotational movement. So these are again monoxial because they're just moving in one plane here. And the example, as we mentioned, atlantoaxial and proximal radio-ulnar joint. And here you're looking at how the atlas over the axis, and they are rotating around these long axes. Axis of the body. And the third type is a saddle joint. When you look at the shape of a joint, you see that it is like a saddle. It has a depression on the middle and an elevation on the both sides here. And due to that one, it has a biaxial movement because it can move in two planes. And they are going under angular motion here. And first, carpometacarpal, CPC here. That's a good example of this movement. Pay attention, this is the first metacarp, second, third, and these are the carpal bones. So we're talking about this joint between the carpal, that here is trapezium, and the first metacarpal bone. So the joint between the trapezium and the first metacarp is the saddle joint. And hinge joint that we thought that is happening, like for example within the elbow, these are monoxial because they are moving in one plane only, and these are moving, making the angular motion. So what type of the angular motion is flexion, extension, hyperextension. The example for those is elbow and knee, ankle, and also interphalangeal joints. So all those interphalangeal joints, they're just moving in one direction here. So these are all the hinge joints. And ellipsoid joint, if you look at the picture, you see that this end of this bone is a little bit projected. This end is like a disc, a little bit inward, and it's like a shape of the ellipse. And these are biaxial as they are moving in two planes. And these are making the angular motion again. And the examples of those ones, ellipsoid joint, as we thought, like might be between carpometacarpal, haven't been shown here, and also, I'm sorry, not carpometacarpal, metacarpophalangeal that we discussed before, and you have it here, metacarpophalangeal 2 to 5 that haven't been shown in this picture, and also radio carpal joint here have been shown here between radius and carpal joint. That you remember, this is the first one, is scaphoid, and metacarpal phalangeal joint that we just have it here. So the last one, ball and socket, that we said is like a ball into a socket. We call it socket because that's very deep compared to the other joints that you might have this like this, right? So you have it in the shoulder and you have it in the hip joint, and these are triaxial joint, and they have all types of the movement, angular motion, rotation, circumductions, and this one, but not gliding. And these are all the types of the synovial joints and their examples that we need. Now, regarding the intervertebral articulations. So you have all the bones of the vertebral column, each one as a vertebra. Now, what type of the joints we have between the vertebrae? We call it intervertebral articulation. So adjacent vertebrae articulate at their superior and inferior articular processes. So that's one point of articulations between, like if this is a vertebra, on each vertebra you remember we have one superior articular process, one inferior articular process. This superior articular process makes a joint with the inferior of the upper vertebra, and the same for the lower side. And also the adjacent vertebral bodies are separated by intervertebral disc. So intervertebral disc is located between the body of one vertebra and the body of the next vertebra. Right? Now, besides those joints that we have, and you need to know, there are some ligaments that stabilizing all the joints that we have in the vertebral column, right? We call them intervertebral ligaments as they are between the vertebrae, connecting the two vertebrae or more to each other. So we have anterior longitudinal ligament. When we say longitudinal, it means that it goes long along the length, right? The whole length of the vertebral column. And these are connecting all the anterior surface of what? Of the vertebral bodies. So they are on the anterior side of the vertebra. And you remember the anterior side of the body of the vertebra. And you remember that the bodies of the vertebra are always toward the anterior in the anatomical position. So these are coming, let's see, like as if it wasn't a skeleton and it had the anterior longitudinal ligament, you could see that when you look from the anterior side. We have interspinous ligaments that connect the spinous processes of adjacent vertebrae. Like imagine this is one vertebra, this is the next vertebra, this is the spinous process, this is the next spinous process. You have them between them vertically, right? I will show you the picture. Supraspinous ligament that connects the tip of the spinous process only, not the whole length of the spinous process, just only the tip. Like if this is one spinous process, this is the next spinous process, only the tip of them are connecting to each other, and that's the difference between interspinous ligament and supraspinous ligament. The next two, posterior longitudinal ligament that connects all the posterior surface of the vertebral bodies again. So pay attention, this one is on the other side of the body. So in other words, it goes into the vertebral canal, right? In the posterior side of the body. Pay attention to the location. I will show you in the picture to realize it just goes like a band, but just this is the anterior in front of the body, posterior on the back of the body of the vertebra. We're talking about the body of the vertebra. And then ligamentum flavum that connects the lamina of the adjacent vertebra within the vertebral arch. You remember arch, you have a body and you have an arch that comes from the pedicle, and then following that you have the transverse process and it continues with the lamina, and then at the end on the posterior you have the spinous process, right? So this is an arch, and the lamina propria connecting the ligamentum flavum is connecting the lamina of the adjacent vertebra. So let's look at the picture. First, let's see the articulations that you have one here between, like this is the superior articular facet and this is the whole process, superior articular process, and this face of that is the facet, superior articular facet. This is the inferior articular process of this vertebra, and you have the facet on the behind that, you don't see that, and you see that the inferior articular process of this one connects and makes a joint with the superior articular process of the next vertebra. You have a joint here. and this is the joint that keep all these ones together and at the same time makes the movements possible. But if you have problems in these joints, that's the source of many pains that you may have in the vertebral column. So that's one joint. The other one is the one that we have between the bodies, this body and the next body of the vertebra. This is the one that we call it intervertebral disc, and it composed of two parts. As I have this picture, let me explain. You have the next slide for that. In the middle of that, like a nucleus, you have nucleus pulposus, and around that you have all these layering. Is like an onion shaped layering around that. We call it annulus fibrosus, right? And at the end you have an end plate on the two sides of that. So this is the structure of the intervertebral disc, and this is the one that may get dry and may get herniated, get out, and when they get herniated, may put pressure over the whole spinal cord that passing through that, or they may put pressure over these spinal nerves that are passing over here and cause the pain. That we call it herniated disc, because this intervertebral disc is getting herniated. Now, going over the ligaments that we have here. So you remember this is the body of the vertebra, then you have one vertebral arch here behind that, right? So between the bodies you had the disc. Now on the anterior side of the vertebra, as you see here, the whole length, you have anterior longitudinal ligament. On the posterior side of the body here, you go all the way down, and you can see that here you have posterior longitudinal ligament. It goes down behind the body all the way down here, like this one. Then let's go over the spinous processes. Between the spinous processes here you have interspinous ligament between them, the whole process. And if it is only over the tip of the spinous process, we call it supraspinous ligament. I'm sorry, I said interspinous process, interspinous ligament here, and supraspinous ligament here. And finally, the last one here between the lamina. This is the, here the pedicle has been cut, and then you see the lamina here. Between the lamina of each vertebra with the other next vertebra, you have the ligamentum flavum. Ligamentum flavum location is here. So, as I explained, intervertebral disc, these are pads of the cartilage between the vertebral bodies of the adjacent vertebra that has two parts. In the center you have nucleus pulposus, around that you have annulus fibrosus. As you saw, you have the picture here, you can see that again. And regarding the type of the movement that you have over the vertebra, between the vertebra, you may have anterior flexion, when the whole body flexes like that, anterior flexion, bending forward. When you get back, we call it extension, and you may have in some parts, you may have hyperextension, but not much of the whole things. And when you go bend backward, lateral flexion, the same way that you had the lateral to lateral. Again, lateral flexion, your plane, when you go lateral flexion, you just bend to the side here, like this. That's different from the rotation that you are twisting. So when you, or if you consider your neck not moving, if you just move and bend the wrist, the waist here to the side, this is the rotation, that is twisting. But when you go just side to side, this is the lateral flexion. So these are the movements of the vertebra that we have, and that is the end of this chapter. As much as you need to know after this one, these are just some slides that they are valuable. They're showing the structures of the, like for example, the important joints of the body, temporomandibular joints that you can see, like for example the shoulder complex, all these structures and all those ones. And also after that you see all these ligaments that we're going to have them all in the lab, so that's very valuable to go over those ones for your lab. For the elbow joints, all the ligaments that we have around, and for the knee joints that discuss a little bit, and you have all the pictures here, and for the hip joints also all the ones that you have here, so you can go over them. You don't have much time to cover them and you won't be as in the lecture about these ones, but still those parts that are included in the lab for these ones you need to know for the lecture part too. So that's the end of the video for the second part of the video for the chapter 8 articulations. Have a great time. Bye.